There are many elements of action, but perhaps the most well-known is using the curcumin contained in turmeric. Curcumin because it is the most well-known active principle, but in principle the entirety of that organic turmeric that I explain, I also try to explain in much more depth in the master's program, which is now in its 4th edition starting in October. I teach the subject of phytotherapy, where I also try to explain this. In this case, well, we talk about how turmeric also has the potential to stimulate stem cells, some stem cells, and therefore activate this neurogenesis that, as we have seen on occasions and in cases of neuroinflammation, at least associated with senescence, are inactive. Well, here we find that turmeric does work. But the question is, what type of turmeric? We have moved from normal curves. We are now using highly standardized turmeric in curcumin, but we are starting to realize that even when using high doses, curcumin is an active principle that, due to being liposoluble and very poorly assimilable and highly rapidly metabolizable at the hepatic level, degrades quickly. If we are talking about the fact that even if we combine it with black pepper, we slightly improve the bioavailability, but we do not manage to reach a plasma concentration of curcumin with enough time for it to cross the blood-brain barrier and perform its neuro-anti-inflammatory action. For this reason, in my view, we should weigh the management of those curcumins in microencapsulated format where they remain stable in the blood plasma. And all of this is verified at the technical data level with enough time for the plasma area of curcumin to be optimal so that it has enough time to reach the brain. We see a diagram of a format of curcumin as it is microencapsulated. In this case, it would be in an oligosaccharide. Therefore, on the other hand, we also have, I will only give you a couple of examples. There could be many more. We could also talk about antioxidants like quercetin, since we have milk thistle, where there are papers like this one that review the chemistry and neuroprotective effects of silymarin as the main active principle of milk thistle, as well as this paper on its potential, the potential of silymarin with its anti-Parkinson's action, or also in Alzheimer's. Well, here are products that can combine microencapsulated turmeric with milk thistle, and here we already have many tools that can help us solve. We have thus taken a bit of a bird's eye view so that we have a broad, comprehensive understanding of what is happening and how we can help with neurodegenerative solutions. And now we are also going to take a quick look at mental dysfunctions, as you can see here in the chart, such as depression, which could also be related to anxiety and stress. Well, in this chart, in response to an injury, inflammation appears that affects us, and there is an adaptive response that, depending on the degree and extent of this inflammatory response, including whether it is systemic or local, can lead to metabolic and neuroendocrine changes to conserve metabolic energy and allocate more nutrients to the activated immune system in such a way that the behavior of the disease manifests as sadness, fatigue, decreased libido, and it can also lead us, as I mentioned before, to metabolic syndrome. With this, I want to say that sadness, fatigue, or depression could also be an adaptive response to a chronic, low-grade inflammatory process. Well, here we would focus. This needs deeper examination, which is what we do in the course, where stress affects different brain areas like the hypothalamus and then the gland, the pituitary, which activates a neurohormonal secretion that ultimately activates cortisol, which reduces inflammation. But if stress is chronic, somehow pro-inflammatory cytokines are secreted that turn off the switch, that turns off inflammation, meaning we perpetuate chronic low-grade inflammation as a consequence of chronic stress. In this work you see here, it has also recently been discovered that chronic stress reduces tissue sensitivity to cortisol. More specifically, what happens is that the immune cells responsible for producing inflammation become immune to cortisol. The off switch for inflammation breaks, as we saw before, and inflammation remains continuously activated, which is a bit what you see in the diagram on the left. That is, chronic stress is associated with the inability of immune cells to respond to the hormonal signals that normally regulate inflammation. Here you see that the pathological nexus, where it is indeed rooted, associated with stress, lifestyle, and age, can also flourish in a very good sense of the word. The different pathologies associated with the current modern lifestyle, among them neurodegenerative disorders. And finally, in relation to anxiety and depression, which are usually under the umbrella of chronic stress, here we should see that currently we do not have the mammoth chasing us. As I have mentioned in other conferences, the concept of stress we adapted from our ancestors. Only now we see the mammoth when we have to speak in public, when we have to take a plane, and we panic about flying, or when we have to talk to the boss. Therefore, all these circumstances of chronic stress associated with modern life that our body perceives as real threats alter the functioning of the neurobiological stress circuit. And there can be two types of mismatch in the sympathetic adrenal medullary axis, which is the SAM, and its final product, catecholamines, which seems to be more associated with anxiety problems, or a mismatch in the hypothalamic pituitary adrenal axis, the HPA axis and its final product, glucocorticoids, which seem to be more associated with depression. This would be the metabolic background, and there wouldn't be time to delve into it, but I like to define the triad associated even with the concept of pandemic fatigue. From stress, which is the president's concern, that should be managed with adaptogenic substances, basically ashwagandha or rhodiola, for example, the 2000. Anxiety. The anxiety that is the worry about the future should be managed with anxiolytic substances, with GABAergic substances, and here we have the typical calming plants, for example, valerian passionflower hops and oats. And finally, what is depression, which can be associated with the melancholy of the past, should be managed with antidepressants. Well, when I say anxiolytics or antidepressants, I am referring from our field of action to those plant-derived substances with anxiolytic action, as I just mentioned, or in this case with phytochemicals of antidepressant action, which could especially be the most well-known, St. John's wort, Hypericum perforatum, which has a mechanism of action as both an MAOI and an SSRI through its main active principle, hypericin. Although now there are also many studies on eperforin, we can also manage it with an active substance that has been discovered not long ago for this, which is saffron, which would also have a mechanism of action, not only like hypericum, primarily with the neurotransmitter serotonin, but also with the rest of the monoamines involved in depression. Here, as I mentioned, it would be a matter of addressing it in more depth in another masterclass.